Very good afternoon. Today we are going to talk about what a typical breast lift consult looks like. एक ब्रेस्ट लिफ्ट की जब कोई पेशेंट आते हैं तो टिपिकली वो क्या क्या क्वेश्चंस पूछते हैं और किस तरह एक कंसल्टेशन का फ्लो जाता है, दैट इज व्हाट वी आर ट्राइंग टू डू. द पेशेंट इज नॉट रियल, द पेशेंट इज वन ऑफ माई टीम मेंबर्स, बट हम कंसल्टेशन को बहुत रियलिस्टिक वे में प्रेजेंट करना चाहते हैं. आइडिया इसका ये है, you come to know what is discussed during a consultation and it is also a source of knowledge. आपको सीखने को भी मिलेगा ब्रेस्ट लिफ्ट प्रोसीजर के बारे में. सो क्वेश्चंस फ्रेम्ड नहीं है, नेचुरली क्वेश्चंस आएंगे डिस्कशन के ऊपर. सो वी गोइंग टू स्टार्ट नाउ. Hi, welcome.
Hi,
How are you doing?
I'm doing good. How are you, doctor?
Wonderful, wonderful. So what brings you here today?
So, I was on weight loss journey,
Okay.
and उसके बाद I felt that breast बहुत saggy हो गई है. I am
Okay.
okay with the size,
Okay.
but breast loose लगता है, तो I just wanted to understand कि क्या
Options
हैं
हैं.
to correct the.
So जैसे आपका weight loss journey चल रही थी, I'm sure you saw this problem or felt this problem some months back or maybe years back. So you never considered doing
Not
anything?
really, because I am into fitness as well.
Right.
So I thought कि workout से भी
हो जाएगा.
हो जाएगा.
And in fact, this is one of the commonest myths. Trainers बोल देते हैं कि आप workout करो and your breast will start lifting up, which doesn't happen.
Yeah.
It actually gets worse with the time.
Correct.
Great. So first of all, I have to tell you कि जो भी हम options discuss करेंगे, that is surgical. So are you okay with that?
Got it.
Non-surgical कोई
Right.
option है नहीं.
Right.
Because I'm sure online अगर आपने कुछ research किया, you might have spoken to friends. People might have suggested stuff like threads or skin tightening machine.
Yeah,
So
I've heard about
you've
it.
heard.
But yeah.
So at the outset, मुझे पहले I have to tell you nothing works. So in case you do decide for anything non-surgical, you'll end up wasting time and money. So while during this consult, the idea is कि you get all the information, but घर जाके you have to wrap your mind around thinking of surgery now, because that is the only solution. And of course उसकी problems हैं. We'll discuss all that. There are a lot of fears. We'll discuss what are your apprehensions about the procedure as well. And I'll also tell you about the complications which you should know as. So let me start with you that why do you want to do something like this?
So that I look better in clothes. I mean, whatever I wear, sometimes I feel if I want to wear something backless. So अगर कुछ भी ऐसा पहनना है जिसमें ब्रा नहीं पहनना, तो वो सपोर्टर पहनना पड़ता है, और sometimes I use
And you're not
boot
comfortable
tapes,
with
and
that.
I'm not comfortable
Yeah,
with
I
it.
got that.
So being young and unmarried, so I feel कि I should get it done. I mean, I should understand about it. And
So do you feel कि आपकी clothing restrictions हो जाती है many
correct.
times?
Yeah.
And maybe have you had a situation जहाँ पे you've actually had to wear tight bras and
Yeah,
pull your
pull-
breast up?
Correct.
Yeah,
yes.
because that is a very common
Yeah.
problem, and eventually that leads to a lot of pain on
Pain
the
and-
shoulder area.
yeah.
Right. I get that. And one important thing you mentioned was you're comfortable with the size of it.
Yeah.
Fine. Great. Now, so I understand कि why you want to do it. Now, मैंने एक चीज बोली आपको कि this is a surgical procedure. And सुन के obviously would have felt कि oops, surgery. एंड कहीं ना कहीं माइंड में आपके रहा होगा घर पे भी जब आप सोच रहे थे कि क्या पता सर्जरी तो नहीं करनी पड़ेगी. सो इज देयर एनी फियर रिगार्डिंग दैट?
Absolutely.
सो लेट्स टेल मी, लेट्स स्टार्ट राइटिंग द फियर्स.
जो भी मैंने देखा है, रिसर्च करी है, पहला फियर
स्कार्स.
Yeah.
एब्सोल्युटली.
Second would be the recovery.
रिकवरी
में पॉसिबिलिटी कितनी है कि इन्फेक्शन हो सकता है,
प्रॉब्लम्स जो है ऑफ
Problems.
सर्जरी. राइट.
प्रॉब्लम्स हो गई कि लॉन्ग टर्म कोई प्रॉब्लम तो नहीं हो सकती,
Yeah.
पेन, एंड ऑल्सो स्कार रिलेटेड कि फ्यूचर में पार्टनर को पता लगेगा या नहीं.
या दैट ओके, आई विल डिस्कस
तो
ऑल दैट.
ये कुछ ऐसी चीजें हैं जो रिस्ट्रिक्ट कर रही है मेरे को
I
टू
get
टेक अ
that.
स्टेप, टू टेक अ डिसीजन कि मैं करवाऊं या ना करवाऊं.
Got that. I got that. So let's discuss this. So scars is something which is a significant problem in all of these surgeries. And scar की जहाँ तक बात आती है, it is all a question of your own motivation to do the procedure versus the scars. So let me explain this. See, अगर हम लोग lift करेंगे, the whole concept of a breast lift surgery is to reshape the entire breast. We have to open the breast up. जो ब्रेस्ट नीचे गिर गया है उसको अपर पोल पे लेके आना है एंड फिक्स इट देयर, एंड देन देयर इज अ लॉट ऑफ एक्स्ट्रा स्किन विच इज हैंगिंग विच हैज टू बी रिमूव्ड. नाउ लूज स्किन अपने आप तो जा नहीं सकती, इट हैज टू बी कट आउट, एंड दैट मीन्स स्कार्स. एट द मिनिमम there's a scar around the nipple area and a vertical line like a lollipop. जो राउंड स्कार है वो दिखता नहीं है, जस्ट फेड्स अवे, बट वर्टिकल लाइन तो रहेगी. एंड अनफॉर्चुनेटली एनीबडी हु लुक्स एट योर ब्रेस्ट विल नो कि यहाँ पे स्कार है. नाउ how do you manage that? You could say that you had some cyst or something in the breast which you wanted to take out, or you could tell the partner that, see, this is what I did. I mean, today I think the society is opening up a lot, people are being very honest with each other, and today men and women are now getting more and more open. So
but what about scar management, like later on?
I'll talk about that. I'll talk about the scar management. So first of all, the most important thing is, let me go over the questions that we raised first. कि scar तो आएगा. Now scar ऊपर से नहीं दिखेगा. So suppose you're wearing a bikini, you will not be able to see any scar. It is only when you sort of lie down when you can actually see the scar. Good thing is, over 6 months to a year, scar becomes very fine, and we can actually do lasers and silicone gels, and they significantly improve over time. I've had a few patients जिन्होंने उस पे tattoo करा लिया. So that is an option. So like I said, motivation versus the scar. Suppose you feel today as a young lady, आपकी personal life hit हो रही है and you're not comfortable, then suppose I say कि इस surgery के बाद you have the freedom to go braless and just get some pasties on and go wear whatever you like. So immediately हो सकता है you might feel, wow, is that even possible? But at the cost of scar. So scar को we can always manage over time, but if I say कि scar नहीं आएगा, that's a lie. So you have to wrap your mind around this fact. So this is the scar thingy, and unfortunately Indian patients में scars बहुत अच्छे नहीं आते हैं. That's a sad thing, but we do have excellent modalities of scar management, and once we move closer to a decision, I'll get one of my doctors to sit with you. She specializes in scar management, and they'll sit with you and discuss what you might, how things will move. Second thing you asked me about was recovery. Before that, the procedure like this typically takes about 2 hours. It's done under anesthesia, and same day you can go back home. The great thing is, within 3 or 4 days, you can actually be in office. Now, depending आपका किस तरह का काम है, what do you do?
I'm into corporate.
You're into corporate work. So that means desk job. So desk jobs, suppose you do a surgery on Thursday, Monday you can be in office. But if you want to, like you also said, you're into fitness, I would not recommend going into the gym for at least 3 or 4 weeks. You can start gentle cardio work as soon as 7 days, but anything related to the upper body, not before 4 weeks.
How about heavy weightlifting?
The heavy weightlifting will take 6 weeks. So you can start with something like, arms, little bit of shoulder work by about 4 weeks, and gradually जैसे जैसे आप comfortable होते जाएंगे, आप heavy weightlifting पे जा सकते हैं. But 7 to 10 days later, you can start with cardio work, जैसे cycling है, steppers हैं, maybe gentle fast walking on treadmill. You can do leg work. आप abdomen की exercises शुरू कर सकते हैं in as soon as 10 days. Just avoid the upper body. So after discharge, you only have to see me after say about 1 week and then 3 weeks. You have to wear a special sports bra, because हम normal wide bras allow नहीं करते. They cut the stitches.
Okay.
Per se problems as such कुछ नहीं है. Sometimes healing delay हो जाती है in people who are smokers. I don't know if you smoke a lot. No, once in a while it's okay, doesn't matter. And some people are low on their diet in terms of proteins, so उनकी healing delay होती है. Otherwise healing moves perfectly well, and we actually don't see too many problems there.
Like any long-term problems like pain?
No, in fact, I would say 3 to 4 days later, तो इसमें pain भी नहीं होगा. Nothing at all.
And what about the sensation, nipple sensation?
That's an important question. I think sensation and then breastfeeding, because one important thing is, you said you are young and you're unmarried, so breastfeeding becomes important later in life. So sensation can change initially. Sensation कम हो जाती है first 3 to 4 weeks के लिए, but you will restore it completely.
100%.
100%. Only breast reduction में थोड़ी सी sensation suffer करती है, but not in breast lift surgery. So that's not a problem. As regards breastfeeding, you are unlikely to have problems of breastfeeding in breast lift surgery. अगर हम breast reduction करते हैं, उसमें of course problems आ सकती हैं, and उसका concept ये है कि suppose we consider the breast as a milk factory. So the milk producing structures are say 100 in number and reduction में हमको breast को 50% करना, तो 50% of the milk production units निकल गई. अगर वो निकल जाएंगे तो 50 तो बची, and 50 जो बचेंगी वो 50% ही दूध बनाएंगी. That means you cannot have enough milk. So the amount of milk production will reduce. However, breast lift में that is not a problem. So largely 80 to 90% of the milk production units are intact. So breast lift, you do not have problems of breastfeeding. So that is good, great news for younger, the younger population. And in fact, it is the younger population who wants these surgeries. जैसे हम 40-45 हो जाते हैं, today people are not really looking for a lot of this stuff.
Like, I understand I've mentioned that I'm okay with the size, but still, if I want like a
slightly larger size,
not larger, a natural size, but थोड़ा perky, थोड़ा ऐसे लगे कि you know.
That's a good point. Now, suppose you wanted to look sexier than more perky, more sort of noticeable. People find it attractive.
I just want to understand the benefit of with implant and without implant.
So we've done a lot of research on this because normally मैं ही बताता हूँ ये patient को कि implant डालना है कि नहीं. So what happens is most people have a fear of implants. उनको लगता है कि implant डालेंगे तो breast बहुत बड़ा हो जाएगा. Now the interesting thing is implants come in sizes as small as 150 cc, जो कि इतना सा होता है. Now why implants? इम्प्लांट क्या करता है कि ब्रेस्ट को स्ट्रेच कर देता है, अपर पोल को टॉप हेवी बनाता है, which means you get a very nice upper pole fullness. So if someone like you doesn't want like a large breast, we can do a very tiny implant like 150 to 200 cc, get that upper pole, lift up the breast, tighten it, and you get a very firm top heavy breast, and you actually probably will not ever, you'll not need to wear bra at home at least for the next 10 to 15 years. I mean, you literally go braless.
After breastfeeding as well?
Post-pregnancy breastfeeding, you will definitely have a little bit of sagging, but never to the extent that you have it today. आज जितना तो कभी भी नहीं होगा. Maybe 1 or 2 centimeters, but not much. And I can positively say कि on most occasions, you'll actually dump the bra. As simple as that.
So if I go without an implant, and right now I'm like, if I'm in my 30s.
Yep.
So when I'll be in my 50s or 60s, for example, तब breast पूरा फिर से sag हो जाएगा?
नहीं. It will never be. In fact, जितनी sagging आज है, इतनी तो कभी भी नहीं होगी. Even if you're 60, so it will always remain lifted. Of course, as we age, skin का structure change हो जाता है, जो skin के अंदर का collagen होता है, वो reduce हो जाता है. So there will be some amount of sagging for sure. Mostly plastic surgery में we say कि 10 to maybe 15 years के बाद you might want to do a repeat surgery. At that time तब देखेंगे, but take it and take it in a good way that you will never come back to what you are today.
Got it.
So that's that. And in terms of follow-ups and all, I think that's important. Follow-ups and costings. Follow-ups में like I said, we'll see you after a week, then 3 weeks, then 3 months. बाकी my team will be of course in touch with you. And you can now sit with them and understand all the costings on the logistics of doing a procedure like this.
So I wanted to check with you कि अगर मुझे पहले ही result देखना हो, for example, something called 3D simulation, मैंने आपके वीडियोस में देखा था for implant. I don't know अगर lift में हो सकता है.
Absolutely, it is possible.
So
it is possible. So we have this. In fact, your pictures were taken in the consultation by my team. And I've got your pictures, and we actually created your simulation of how you will look like after. And as you can see here, so you're likely to look like this after. तो जो breast की sagging है, जो nipple की direction downwards है, you can see कि अब वो बिल्कुल straight facing है, and the breast is lifted right on the top. So this is actually how you will look like after surgery. And my team will of course show you results of other patients, and that will give you a lot of confidence कि किस तरह eventual shape आती है.
And one last question, जैसे अभी सिर्फ lift कराया, right? So after 15 years, अगर breast जितना भी percentage sag करता है, तो upper pole deflated feel होगा?
Yes, for sure होगा.
And if I go with an implant,
then it is not likely to appear deflated. However, having said that, अगर आपके skin की quality अच्छी है, there is no stretch marks, it's not spongy skin, soft skin नहीं है, then you might not need an implant even now. Maybe after a decade, you can consider a revision procedure and then get an implant lift repeated.
For that lifted look and okay. So Okay, sir, I'll understand regarding the costing thing and wanted to check the EMI option here.
Absolutely. So we have EMI options for all plastic surgery procedures. आप choose कर सकते हैं 6 month, 12 month या 24 month plan, and it gives you a lot of freedom in choosing the procedure, so that cost constraint नहीं रहता anymore, and you end up paying something like maybe anything from say 5 to 10,000 rupees a month, and that becomes very easy now to do a procedure.
Can this be covered under insurance?
Breast lift cannot be
No.
covered under insurance. Breast reduction can be covered under insurance. Yes.
Got it. Thank you, doctor.
Most welcome.